the next steps are, hey, if having an online members portal with all the training, with all the forms, with the risk assessments, having the binders done for you with compliance plans and ongoing support sounds good, then let's focus on number one. Let's purchase and move forward. Number two is the setup process. Okay, what do you do from here? Well, it's pretty simple. You get an email with a confirmation for each account. If you're just one office, then you'll just purchase one. You'll get a confirmation that will have login information. From there, you'll go through a setup process, which I'll show you in just a minute. In 48 hours of the purchase, there's an implementation specialist that will contact the administrator of the program and we'll walk them through setup, which I'm going to go through very quickly right now. And then number four, you just, on an ongoing basis, call and talk to us, email any questions, and we focus on ensuring that risk is reduced to protect your patients, protect your reputation, and ensure that you're constantly improving on your compliance plans. Okay. Now, from here, I'm going to go to HCSI.com. Okay. And then what you're going to do is you'll click on healthcare providers. After your confirmation email comes to you, there will be a login. There will be login codes. And the office ID I'm going to put in there, and then the employee ID. You can tell I've done this before, right? And then you sign in. Okay, now the nice thing is tabs, but everything will have this disabled pop-up except for setup. Once setup's been completed the first time, you won't have to worry about that again. The only thing you'll do in the setup process is add your staff. Once employees are here and you've designated somebody to be the compliance officer for HIPAA, OSHA, and Medicare, that person will go through. Oh, by the way, you can add and delete employees here. If there's turnover, you simply add the employee. If you want them to be one of your compliance officers, you simply designate them. Compliance officers here will start at the policy section and go through and create a policy manual. If there's a need to create custom policies, well, you can do that with us. If the implementation specialist provides some recommendations, he can help through that. But you create your policy manual. After you've created your policy manual, the government wants you to focus on environmental, facility, and hardware and software risk factors. I'm just going to click on facility. And you'll find there are several risk factors. One of them that's very popular is record snooping. And with record snooping, have any safeguards in your system, in your software program that provides an alert, well, that's a good thing. But if each employee that you have in your organization hasn't if you don't have, it says how much access they're allowed to have for that position, then you may be in the medium category. Okay, so from here, you identify risks. This is, again, facility. So facility, you'll have locked doors. You may have some property controls. You'll click a minimum of five items and then click update. Okay, so they'll go through that really quickly. All the remedies are down here at the bottom, and they do show up to the right of each risk factor. Okay, OSHA. OSHA has a risk assessment, a hazard risk assessment, for example, where you identify instruments, equipment, chemicals, gases, and vapors, and then any additional things that are customized for your office. And with this, let's say you're a physical therapist, and yes, this is a healthcare provider's, we're a healthcare compliance solution for healthcare providers across the United States. So yeah, physical therapy equipment may not be something that you may use, but you may have some of these chemicals or gases and vapors or other things that that are applicable. Okay, and all you'll do is just simply select what is applicable. Okay, and these risk assessments should be done every year. After it's done one time, it'll be really simple to just go down the list for your compliance officer in that location and see what's applicable. Okay. After that's done, so I'll click on this training tab, and everything will be grayed out except for what you're able to do. So you'll go through general setup, and then after general setup, there is a HIPAA security setup, and then after this HIPAA security setup, the actual training will be available. Now, let me just ask, how comfortable do you currently feel with the person representing compliance in your practice? Do you feel like they have any idea of their role and responsibilities to implement compliance policies and procedures? Well, if your confidence level isn't super high, which I imagine that there's always some improvement wherever you're at, we have management training that your compliance officers will go through for each of these modules. And we do that because we want to ensure that the compliance officer understands the landscape. If you just had a consultant just come in one time, certainly they could do the training, they could implement a bunch of things, but when you think about it, if an auditor comes, they're not going to be asking for the consultant, they're going to ask for the expert at the office, and that individual is going to be somebody that has been communicating all the forms, the roles and responsibilities of others that are implementing this compliance program. Okay, so we want to make sure there's a training that's been put in place for your compliance officer to ensure that they feel confident in their responsibilities. Okay, now I'm just going to click through this. In each of the trainings, there's an area for your staff to click I understand and will follow. Take that to heart and say, okay, you know what? I will do that. I will follow these policies and these procedures that have been created. Okay, and as they move through it, there are several of these for administrators. And I'm going to go back through the employee training because it's a little bit different. For the employee training, in addition to these understands and I will follow as well, we actually do a quiz to make sure that they do understand. Now, if you click the brain and that's not the right answer, then you can click the false button or the garbage can, and it'll say great and progress you through this. Now, when the training's finished, there's a certificate that will go into the employee's file, and then the employee also keeps one for themselves. There's an online reference guide of all the laws. You'll also have a hard copy of that. Here are all the customized forms. And there's about 100, and each of these have a table of contents. And throughout the year, we do administrative alerts. We just did one at the beginning of each month, and these provide any of the updates that administrator or the compliance officers will need to understand. Okay. So purchasing is very simple. When you're at the home tab, it's just pricing, order, renew. Click client order, click purchase, and then there will be 2 screens after that that will walk you through adding your basic information such as employees at this location. Now, if you're logged in the future, this is also a way for you to renew with us. That's why the price only shows $395 here. Okay, so if you do use a test account and you do go through this process, it's only going to give you that subtotal. But you just put in the address information, the email that the updates will go to. We send regular updates to the email. Then you click proceed and put